Hi, Professor Hoffman. I'm sitting right in front of the mannequin because I like to sit down, like if I'm doing discharge, I like to sit down and like talk to the patient. So I'm not just standing over them for however long it takes me to go over the discharge information. I do have my iPad here with like the discharge information on it because I was like, oh, I'll just print it when I get over there. There's no printer, so I just want to let you know before I get started. But anyway, oh, I feel so silly. Okay, 1, 2, 3. Hi, Miss Casey. My name is Sabirah. I'm here to go over your discharge information. So I know you came in a couple days ago, or about a week ago, because you were experiencing some shortness of breath. You were diagnosed with COPD, which stands for chronic. One second. Chronic obstructive pulmonary disorder. It is a lung disease that messes with your airways. So essentially, like, your airways become narrow and inflamed, and it can make it like harder to breathe. That's why you're experiencing the shortness of breath. COPD can be caused by many things, but one of the biggest risk factors is smoking, unfortunately. That's why it is important for your current health and your future health to try to quit. I understand. I was vapor for 5 years. I know how difficult it will be, but your body will thank you in time. If even like considering slowing down, so even if you don't feel like you're in a position to completely quit just yet, it will definitely help if you try to cut back on how much you're smoking every day and go from there. If you need any resources, because again, I know how difficult this can be, you just let me know and I can get print some out for you before you get out of here and leave. And we're gonna go over your medications later, like your medications you're being sent home with, the new ones. One of them is a nicotine patch, and that will definitely help with the cravings if you do decide to completely quit cold turkey. I believe in you. You can do this. Let's see. So going down the list, so there's no changes to your home medications. You're going to keep taking the metformin, 500 milligrams daily, and then we're going to go over all your new ones, and I'll walk you through everything. So you do have your nicotine patch. It's going to be 21 milligrams once a day. So again, that will help with like the cigarette cravings. If you are stopping smoking, if you're not going to stop smoking, don't use the patch and smoke as well, because too much nicotine, and it can give you headaches and all kind of make you feel like all nasty inside. But you put the patch on clean, dry skin. You can do like your upper arm or your chest every morning and leave it on for 24 hours. It slowly administers like the nicotine over time. Rotate where you're going to put it every day, so like the skin doesn't get irritated. But if you're noticing any rash or any dizziness, take the patch off and you can call your primary. So we'll go down. You also have your albuterol inhaler. They're going to be sending you home with 2 inhalers. You have your rescue, and then you're going to have your maintenance so your albuterol inhaler, that's your rescue inhaler. So you use this whenever you start to feel like shortness of breath, if you're feeling wheezy or any like chest tightness. So before you use it, give it a little shake. Breathe out first. Put the inhaler in your mouth. You press down and take a slow, deep breath in, and then you're going to hold it. And then you're going to breathe out for a few seconds. It's okay if you do need to take a second puff if you're not feeling the effects quite yet. But just wait a few minutes in between and don't go over. Like if you can continue to use your inhaler and you're not getting any relief from it, definitely go to the hospital or call your primary. So then for your second one, your Spiriva, I hope that I'm saying that right. You're going to take 2 puffs of that twice a day. So this is your maintenance inhaler. So if you are feeling any kind of shortness of breath, don't take this one. That's when you would take your rescue. Your maintenance, you're going to take it once in the morning and then once at the evening. Try to make it about the same time every day, even if you're feeling fine, because this helps you to continue to feel fine. That's why they call it like the maintenance inhaler. And again, it won't work for any like sudden shortness of breath. You use your albuterol for that one. And you rinse your mouth out with water after you take it in the morning and you take it at night. And then on both of the inhalers, they will tell you like how many puffs you have left. Try to keep track of that so you can make sure you're reordering your medication at whatever pharmacy you go to before you run out, so you don't have any like if you are experiencing some shortness of breath, make sure you have your relief with you, your medication. They're also going to give you some prednisone. Usually when everyone comes in with complaints of shortness of breath, they put them on prednisone for about 5 days. That's normal for, I just lost my whole train of thought. That is normal, is what I'm trying to say. Anyway, this helps to reduce swelling and inflammation in your lungs to help you breathe better. Try to take it in the morning with food. Taking it with food helps to avoid it like making your stomach feel all yucky. See, don't stop it early unless your doctor tells you otherwise. So even if you're feeling better, still continue to take your medication, because the same thing with antibiotics or even your like maintenance inhaler. If you're feeling better, that's good. You're supposed to be feeling better. We want to make sure you stay feeling better. That's why you have to take it for the entirety of the 5 days. So the doctor wants you to also follow up with your pulmonologist within 3 days or sooner if you're feeling any worsening symptoms. And then before we get out of here, I am going to give you your flu vaccine. I switched to recording over here. The mannequin does have the arm pad, but I couldn't find anywhere to like set the phone up. So I do have all my material down here, and I also have my skin pad. I know we're supposed to be doing like the discharge for the patient, but I wasn't sure if you wanted us to like verbally go through everything as if we were doing like an IM injection in the lab. So I'm gonna do it as if we're doing an IM injection in the lab. So I would do hand hygiene. I would have all my gloves. I have all of my material here. So I have the flu vaccine, the needle that I'm gonna use to drop with, needle I'm gonna use to inject, and then the syringe. Before I gave them the vaccination, I would ask them if they have had the flu vaccine. First, I would make sure they want the vaccination, and then I would ask them if they had any reactions to vaccines in the past, and if they have any allergies, since it is technically a medication. So all the normal things I would when administering medication. So I'm going to do an injection into her right deltoid. So for mapping, find the acromial process. Helps when you like raise your arm, and then from here I will 3 fingers down and then make a V. Kind of hard to do, but I have the V like right here. It's not straight enough. I would have the V, and that would go like right here inside the V. So I'm gonna go ahead, I'm gonna get my alcohol swab. I'm going to clean the vaccine for 30 seconds. 30 seconds. And I would leave this little, I can't think, the swab like on top of the vial while I get my needle ready. So I'll open up my pink needle with some drop with. Connect it in here. Take off my needle out. And then in this vial is, see how much is in this vial? 20 micrograms per milliliter. I'm going to take out the entire contents of the vial, but it does not say on it how many milliliters are in here. I'm assuming it's around 3. I'm gonna draw this out the way, put it down. My needle like this, do it straight down in there. Then I have the tip of the needle right at the base, so I can try to get as much out as possible. Removing, turn it a little bit. Okay. See, hold my needle up like this, make sure I got everything out. I don't have to re-inject, we got everything out. I'm going to engage my safety. I'm gonna remove it. And I'm going to push this up a little bit. There we go. I would take my medication and I would attach it to the needle that I'm going to drop with. I'm gonna leave it in here while I clean. Out. Like this up. Go like this. Invert my needle straight into the skin. I'm gonna push everything in. I'm gonna hold. about 10 seconds. I'm gonna take it out. Engage safety. I'm gonna get rid of this and then get rid of this. I would end by making sure the patient didn't have any extra questions. After I went over the medications, I would ask them like between each one if they had any questions. And since now I gave them their flu vaccine, I would let them know that they might feel, I can't think of the word, they might feel a little bit of like just a little irritation at where it was injected at, and they might feel a little bit sick a day or two afterwards. I would just check to see if they have any questions, and after that I would let them go home, give them their papers, make sure they have all their stuff, and yeah.